Well, UK Prime Minister Boris Johnson says up to 90% of people currently in intensive care with COVID have not had their booster jab. There are 2.4 million eligible double-jabbed people yet to take up the offer of a booster, and the overwhelming majority of those in a serious condition in hospital with COVID fall into this category. Joining me now live is the Director of the Digital Health Enterprise Zone at the University of Bradford in the UK, Dr. Liz Breen. Doctor, good morning. Thank you for joining us. Boris Johnson set a very ambitious target to get a significant portion of the population triple jab before Christmas. How did that go?
It's been going really well, actually. We obviously, as you said, had a very ambitious target. And that being the case, we said that we had already been rolling out the booster campaign from the start of October. And then at the end of November, we added another 25 million people into that eligibility pot. And that was really a challenge. However, our staff have really risen to that challenge. We have managed really successfully to vaccinate with the booster doses 33 million people. And yes, whilst we still have that 2.4 million who are eligible and who haven't come forward, we've done an absolutely cracking job at rolling out the booster, plus still delivering first, second doses and getting those numbers up to get that greater coverage. So, the fact that we have done so well with regards to the overall coverage of vaccinations is absolutely spectacular.
Yeah, that's a phenomenal amount of people that have already come forward. Can you tell us about the significant resources being used to get the third doses into arms?
So obviously we put a plea out to our NHS staff to be able to step forward and to be able to deliver in our vaccination sites. And they've been amazing at doing so, even working on Christmas Day and Boxing Day, still pushing out those vaccines to people who obviously felt that they were able to come and attend in those days. And obviously the original plan at the end of November was to make sure that we opened either existing previous vaccination sites or new sites, make mobile sites available, everything we could do to make sure that people had the opportunity to get this booster dose, because it's been very much a package of get the vaccinations, be responsible with your social testing and your testing. So that would allow us to be more normal over Christmas and New Year. And that seems to have worked incredibly well with regards to that message going out. Get jabbed, keep doing the testing, and prioritize the social engagement over Christmas and New Year.
Yeah, a phenomenal effort by NHS to keep working over that Christmas period as well. Australia is very new to this notion of living alongside COVID. It's something that the UK has done for some time. The UK is seeing a spike in cases currently. Do you think that that is actually encouraging people to book that appointment and get a booster dose? Is that encouragement enough?
It is actually, because I think, as I said, this package whereby you need to get your vaccination, but also you need to do your testing has really been sold quite heavily by the government. And people have been buying into that. Now, obviously, that has caused some problems as well, because we seem to have a huge shortage of lateral flow tests. And also we are having delays in our PCR tests, being able to get access to them, but also being able to get the results from them. And that's obviously something that other countries such as yourself have obviously experienced as well. But the message is loud and clear. From a public health view, we need to get our booster dose. We need to get our first dose, second dose. We need to get our booster dose. And that will help keep us safe, but also keep others safe as well. And also then we need to make sure that we are responsible by doing the lateral flow test, either during isolation, close contact, or for those people who need to make sure they do it when they're returning to work.
Seems like delays everywhere with the PCR testing. Dr. Liz Breen, we appreciate your time this morning. Thank you for joining us from Bradford.
You're welcome.